Good morning, everyone. My name is Dr. Katrin Tamari. I'm the Director of Intake and the Patient Assignment. Majority of you have seen me when you came in through the clinic. I have two wonderful students with me today, Zachary Brack and Victoria Yang, who have helped me to put this presentation together. And what we are going to talk about today is oral health. Now, there is going to be a QA at the end of the session, and you can submit all your questions. As you can see all the way in the bottom of the page, there is a circle that it says chat, but instead of that, there is a arrow that it shows QA, and you can submit all your questions through the QA, and we will try to address all the questions at the end of the session. And what we are going to talk about today is why teeth are important, why is it important to have good oral health care, and what is considered as an emergency and what is not considered as an emergency, and how we can prevent it and proceed. So this is the COVID-19 time, and this is the time that all of our lives has been changed tremendously in many ways. Majority of us are not going to work right now. We are trying to do our work from home, and a lot of us we are neglecting our health, which this is not the time. We really have to be on top of it, and we have to make sure that we are going to take care of our health even better than before. And since the dentists are not really open to provide non-emergency dental care, again, this is a crucial time to keep up with our dental home care. And here at Touro Dental Health, we are here for you to help you out, to talk to you, to give you any information that you need to make sure that we are going to reduce the amount of emergency and prevent the emergency that it might happen. And why teeth are important? We need our teeth for appearance. Everybody wants to look good. It gives us a self-confidence. We need them to be able to speak properly and to be able to eat. The problems that we are facing with oral health are tooth decay or cavity, periodontal problems or gum problems, and lack of salivary flow. And about tooth decay, this is the part that Zachary Borak, one of our third year dental students, is going to cover, and is going to give you more information about it.
Good morning, everyone. So our teeth are covered by a surface called enamel, which happens to be the strongest surface in the body. However, acid, that comes into our body from food, the different types of foods we eat, carbs, starches, and particularly sugars, will slowly break down that enamel. That's why it's very important to floss and to be able to clean out any of the remaining sugars after we eat. When we're done eating, to floss at the end of the day and to get rid of any of the remnants that are stuck in our mouth. But that acid will slowly decay and break down the enamel, which causes the formation of cavities. Next slide. So different types of foods are more likely to create that acid and build that decay. Things like sugars and candies, soda, especially drinking sodas over a long period of time, we'll talk about in a minute, will really break down the teeth and allow the cavities to grow. So the healthier we eat, the less of a chance of our teeth breaking down and cavities forming.
What is periodontal disease or gum disease? This is the part that Victoria Yang, our third year dental student, is going to talk to you about it.
Hi, everyone. So periodontal disease, also known as gum disease, is a major cause of tooth loss in adults. That's according to the American Dental Association. And you're thinking, well, how in the world is that going to work? What happens is the bacteria get underneath your gums and affect the bone underneath the gums as well. And these two, the bone and the gums, surround the teeth. And because of that, your body wants to get rid of that bacteria. So it does something called an inflammatory response. The inflammatory response contains things in your body that come to try to attack the bacteria. However, if it's unsuccessful or the bacteria stays there for a long time, the gums and your bones start to go away from the bacteria. And because of that, you get things like gum disease. In the next slide, there's a picture that we can show you. So here to the left, you see the healthy gums with the really healthy and happy tooth. However, if the bacteria gets underneath the gums, you can see that the gums is getting really puffy, and that's what we call gingivitis, the first stage of gum disease. If you keep the bacteria there for a long time, you can see on the last picture that there's bacterial buildup on the tooth, and the gums and the bones start to fall away. And this is called periodontitis. Here's another picture. So you can see how the healthy teeth are surrounded by healthy bone and gums. And on the next picture over, you can see the gingivitis where the yellow, oh, go back one slide, please, Dr. Tamari. So you can see the yellow representing that bacteria. So if you get rid of that bacteria, you can keep the teeth healthy. But if you leave it there, you can slowly see that the bone and the gums are starting to go away from the teeth. And because of that, the teeth can get very mobile or they're very loose and they can fall out. Next slide. So there's more information about gingivitis, and you can see a real example here where the gums are really red. They are inflamed, so they feel warm or puffy, and they bleed easily. Now you can say that flossing regularly does let you bleed sometimes, but when it continues to bleed over long periods of time, then that's when you know there's something wrong. You might have gum disease. Fortunately, gingivitis is reversible. If you get rid of the bacteria, then your gums can go back to being healthy. Next slide. However, if you don't get rid of that bacteria, if the bacteria still stays on the tooth, then you're gonna have the loss of the gums and the bone, and it's gonna start falling away from your teeth. Like you see in this picture here, you start seeing more and more about the roots of your teeth. And because there's no gum and bone holding the teeth in place, your teeth will eventually become very loose and they'll start moving and eventually fall out. So there's a couple signs that we've kind of reiterated through the last few slides. So the big ones are that your gums bleed easily, your gums are red and swollen and tender, and you can see that you're seeing more of the roots of your teeth. Other signs are if you have bad breath or bad taste that never goes away. Sometimes you see your permanent teeth, which aren't supposed to be loose, being loose and separating from one another. And you can kind of, there's another sign is that you can have changes in the way that you bite or the way that your teeth fit together, or if you wear a partial denture, you may find that it might not fit anymore. So there's different factors that increase the risk of having gum disease. One that we've been talking about is oral hygiene. If you don't floss, you don't get rid of that bacteria, and therefore your bone and the gums fall away from your tooth. Other factors are like smoking or chewing. Maybe you might have a history of gum disease in your family, so maybe due to genetics. If you naturally have crooked teeth, they're really hard to keep clean because it's hard to get that floss down and get that bacteria out. So bacteria have a better place to hide in crooked teeth. If you're pregnant or you have diabetes, or if you have different medications, including steroids and other types of cancer therapy drugs or calcium channel blockers, these are things that may increase the risk of having gum disease.
So the last thing that we are going to talk about is the saliva. So as we know, there are salivary glands that are located by our ears, next to our ears and under our chins. And they produce saliva, which this saliva, it has 99% water and about 1% nutrient and enzyme. And what it does is that it keeps the pH of the mouth healthy. And whatever we eat, if we eat something that is acidic, it makes the mouth to become more acidic, the pH goes down. And what happens is that it affects the enamel, which is the outer portion of the tooth. It makes it become softened, and it increases the chance of getting tooth decay. So what saliva does is that it washes away the acid and the bacteria, and it helps to prevent decay from going further. And also what saliva does is that it makes it easier for us to be able to eat. And if we don't have that, it's going to be difficult for us to taste the food that we are eating. And it also nourishes our mouth with the nutrients. This is the diagram that it shows what happens to the pH of our mouth after we eat. As you can see, right after we eat, our mouth becomes very acidic, and then through the saliva that is produced with our salivary gland, the pH level increases and it gets to the normal level. So there are a lot of instances that the salivary flow it's not as much as it should be, and what happens is that if that's the case, then it takes longer amount of time for the tooth to go back to a normal environment from the acidic one. So, which means the bacteria that are produced by acids, by food, and everything, it's going to stay longer on our teeth. So the longer that it stays, there is there is a greater chance of developing that decay or the cavity. And the reduced salivary gland could be, it causes difficulty in tasting our food, chewing, swallowing, and in some instances, increasing. And as I said before, it's going to increase the chance of having the tooth a cavity, a decay. The teeth could become sensitive, and our mouth is going to become more prone to oral to infections. The things that it could reduce the salivary flow in our mouth, it could be related to medications. There are a lot of medications that it causes dry mouth. And another thing is that if we are not hydrating ourselves, if it's not, we are not drinking sufficient amount of water every day, that could be one effect of it. And if the person feels anxious or stressed, right now it's a very stressful timing. Patients who are going for chemotherapy or they are getting radiation to their head and neck, patients who have some, their immune system is not as well as it should be. People who have uncontrolled diabetes or infections or hormonal changes, these cases, they all can affect the salivary flow and it could decrease it. So what can we do to maintain our oral health? And having a clean mouth and infection-free mouth that starts with a great oral hygiene habit. Okay, so what should we do? As always, prevention is better than the cure. And if we try to keep a good oral hygiene habit, that's going to help us out to prevent, many dental problems. It's going to save us from toothache and costly dental treatments. So how should we accomplish this? Really trying to brush our mouth using appropriate mouthwash and toothpaste. We should really purchase the mouthwash and the toothpaste that they have ADA guideline on it, and we have to make sure they contain a sufficient amount of fluoride because the fluoride is going to protect our teeth and make it more resistant to cavity development. Take a look at the brush. If you see the bristles are out of shape, then if in this case, we really need to change the toothbrush. And it's recommended that every 3 to 4 months, we really should replace our toothbrush and get the new one. And another thing that we should consider is that there is a great relationship between how we take care of our mouth and the way it affects with overall health. If we are not taking care of our mouth and we have a lot of problem, infections, cavities, gum problem, periodontal disease, that's going to affect the heart. If somebody is diabetes, it's going to make complications with diabetic people and many other issues. So really we have to emphasize a lot on our oral hygiene because of oral health, because it's going to affect the rest of the body. As we say, mouth is connected to the rest of the body and it's not separated. So now, what happens if we have a dental problem? What should we do? So this is the timing that really, because the dental offices, the dental clinics, they are all closed for routine dental procedures. We have to try to avoid any emergencies. And what can we do? Try to wash our hands for 20 seconds before and after any personal dental care, because right now we are all working at home, so we are touching the computer, we are on our phone, and so many different things. So really, we should try to wash our hands for 20 seconds to try to have it as clean as possible. Try to brush our teeth at least twice a day for 2 minutes, and floss at least once a day. But at this time, I would say probably it's a good idea to do it more than once a day, and try to rinse with our mouth with a mouthwash that they do contain fluoride. Try to avoid using the mouthwashes that have alcohol, because that alcohol itself, it could cause the mouth to dry up, and that it's better not to use them. Another thing besides are the oral hygiene. We should really try to have a well-balanced diet. Try to limit eating sticky food, sugary snacks like cake and cookies. I understand that we are all are in a stress. All our lives has been changed because of COVID-19. I understand it. I understand that this is because due to stress, we like to have snacks. We like to have cookies. You know what it is, if we like to do that, and everybody cope with stress in a different ways. I really do understand it. But if we are going to have cookies, let's try to limit it. Maybe we want to have it like once a day as opposed to trying to snack on it all day. If so, really try to limit the amount of snacking. The sugary diet, soda and fruit, as we say that those they're going to produce the acids, and the acids is going to affect the enamel, and it causes decay. So you want to have a soda, try to limit it to maybe once a day, not to drink it as all day long, and try to drink plenty of water. Water is good, and avoid smoking. Now, here we are. We are here to help you out to see what we can do to ease up the problem that you might be facing with your oral health. So we developed a virtual visit that is very easy to get access to. We're going to go through it. So we are trying to adjust to changing situation with COVID-19. Touro Dental Health is open for emergency dental care for right now, currently, unfortunately, only for the patients that are patients of record, patients that we have been seeing. Patients who are all calling in, they are going to be screened and to make sure they are symptom free. And one of the faculty is going to get in touch with them and discuss with them, talk to them to see what the emergency is, and if this is something that the patient needs to be brought in, or it's something that it could be wait on it and they just required any sort of a pain medication. And here we are, if we decide that we are going to provide emergency care, we already have implemented federal and state PPE, which means protective wear, to make sure that we are providing safety for our patients, staff, and community. And for emergency, our doors are open from with teledentistry from Monday through Thursday, 9 a.m. to 5 p.m. and Friday is 9 a.m. to 3 p.m. And faculty appointments, it's going to be Monday through Friday, 9 a.m. to 3 p.m. The virtual visit, what it is that you need to log into our website, and there is a very brief questionnaire that it needs to be completed, which pretty much we are trying to get some detail about what the problem is. And within 30 minutes, somebody is going to get in touch with you to confirm your appointment. And they are going to, at the time of the appointment, one of our expertise is going to get in touch with you, and they are going to do a consult over in a virtual way, which it's going to be Zoom through Zoom video conferencing. So in order to do that, everybody needs to have an access to either a smartphone, tablet, or computer, and they need to download Zoom to be able to have the conference with our faculty. And the website is written here, dental.touro.edu. You can go on it, and this is the questionnaire. It's very simple. It takes a couple of minutes to complete it. And again, here we are for you to make sure that we can take care of the emergency you have and make sure you are in a right path. Now, if there is any questions, we'll be more than happy to take care of it. Okay, if there is any question, please enter it through the QA. Again, at the bottom of the screen, there is a QA tab next to participants, and you can click on it and go through any, put any questions that you have. We are here to answer. Okay, so somebody asked, what if I have pain when I'm eating something cold? Is this an emergency? So if the problem is only with eating something cold, I would say probably this is not a true emergency. It's better to be taken care of by trying to brush your teeth with some sort of mouthwash that has high contents of fluoride in it, and toothpaste that it has a high contents of fluoride in it. And usually what we recommend is biotin toothbrush, toothpaste, biotin mouthwash, and try to avoid eating cold. Give it a little bit more time, and let's see if that's going to help out the situation. If not, hopefully when our door is open for non-emergency work, then we can bring you in and we can take care of it. Okay. Another question is that what is a true emergency and what is not a true emergency? So right now, if somebody is experiencing severe pain, swelling, and they are experiencing some sort of infection in their mouth, that I would say this is a true emergency. It's so good to call up or to go on our website and try to schedule a virtual visit, or so our faculty, they can talk to you and they can see your face, and hopefully they can direct you in a better way. And if this is something that they need to bring you in, they can bring you in. They can do a thorough evaluation and let you know what it needs to be what it needs to be done. So one person's question is that was curious about emergency visit. So as I said, the emergency clinic is open Monday through Friday, 9 to 3 o'clock. Before coming in, you are going to be screened for COVID-19 symptoms. And as long as everything is okay, one of our faculty is going to get in touch with you, and they are going to do a brief consult to make sure that this is a true emergency. And they don't want they want to avoid any unnecessary visit. You will coming in and they will evaluate you, and if this is something that they can provide emergency care for you, they will do it. Okay, so I hope I answered the question. Another thing is that, are we able to have this webinar email to us? Would like to share it. I will find out. I know that this webinar it's being recorded, but I have to find out if we can email it. We can email it to you. Any other question?
There was a question asking what specific toothpaste that we recommend. In a previous slide, we showed that there was a little symbol, we recommend using something that has fluoride. And if you still aren't sure what fluoride or whether the toothpaste does have fluoride, we recommend using toothpaste with the ADA seal. It's a little box that says ADA on it, American Dental Association, and you can find that somewhere on the product information. So if you see that box, you know that it is definitely approved by the American Dental Association.
Thank you, Victoria. Thank you. Let me see. Thank you for this. Okay. Any other question? So from my understanding, we could email this presentation to you. So if you can provide me with your email address and with your name, hopefully we can do that. Okay. Any other question? Zach and Victoria, would you like to add anything? No, we good? Okay. I thank everyone for attending this seminar. I hope you find it useful. Please do not hesitate to get in touch with us with any information. This is a very tough timing. I do really understand it. And we are all under a lot of stress. But just remember, if we don't take care of ourselves, we cannot be there for our loved ones. So we really have to take care of our mouth. We have to take care of our body to make sure that we're going to stay alive, stay healthy. Thank you so much. I really greatly appreciate for everybody who attended this seminar. Thank you.